Okay, Jenna, so let's just review. So you've got a little bit of stress urinary incontinence going on. That's why you're having so much leakage. You do have a higher than normal post-void residual. Now, I know sometimes you say you feel like you're emptying better um, than other times, and I have a suspicion that it's linked to some constipation that you have. During your exam, you did have some noted stool in your rectum. So I would like to start you on a constipation regimen with some fresh fruits and vegetables, and get you started on a stool softener, and see you in 1 to 2 weeks to see if that constipation's kind of our culprit and will repeat a post-void residual on you. The reason being is, if you have too much urine retaining in your bladder, there's potential for it refluxing back up into the kidneys and increasing your risk for infection. And there's a handout that I'm going to provide for you, and we'll go over kind of in detail how that urinary system works. Okay. So we'll address some constipation today. Another thing is you have you're menopausal. You have very dry, tender tissue. You also have a systole going on, meaning that bladder is kind of prolapsing on you. Estrogen has been shown to be effective in helping and managing that. Okay, so we'll refer you to a primary physician to address that. You have a very weak pelvic floor. So we're going to talk about some Kegel exercises to help strengthen that, and a knack to kind of purposeful contractions of that Kegel during activity to make sure that we're helping prevent that leakage. Okay. Another big thing is that you have a fungal infection going on from that incontinence and that use of a peri pad rather than an incontinence pad. So we'll discuss, appropriate pads or incontinence wear to make sure that we're wicking that moisture away from the skin. Okay, we want to make sure that we're not doing any sort of defensive voiding. We want to try to make sure that we're retaining our bladder. And then, of course, your pelvic pain, we want to discuss, getting you a referral to physical therapy who will help make sure that you are utilizing and contracting that pelvic floor muscle to improve the strength. Some individuals, have that problem of not understanding how to isolate properly. And so they'll be able to kind of help address that as well as address any sort of pain in that area. Okay. So again, we'll see you in about 1 to 2 weeks after some constipation management. We'll do post-void residual. If it comes back normal, we'll follow up in 4 to 6 weeks and see if we have any improvement with some pelvic floor exercises and some estrogen management. Okay. Do you have any questions or concerns for me? No. Okay. Okay. So I have a lot of handouts we'll go over, and as we go over, feel free to stop me, and we'll review it, and then hopefully, start your road to recovery. Okay. Thank you.